Good evening, friends. I welcome you all once again on this August Friday. We are meeting here to continue our study, to continue our journey in the learning of concept of susceptibility and its application in practice. Spandan and Learning Sparks, both these organizations, they bring to you the series of webinars. Objective is to understand, to comprehend, and to see applications of the vital concepts of homeopathy in practice. So all themes are related to applied homeopathy. Hahnemann has mentioned that homeopathy is the science of experience, the medicine of experience. And it is experiential learning which helps us to grow. Friends, we discussed at length Stuart Close concept and his essay on susceptibility. We began with that, wherein he mentions about capability, the property of the individual, the capacity of the individual to receive and to react. We examined receiving, responsiveness, and reaction in the context of health as well as disease, and how each has its own implication in understanding susceptibility. As we saw, that receiving is directly related to sensitivity, how sensitive you are to receive certain impressions, and then this receptivity will be further examined by the system. The inputs will be processed and there will be response, there will be reaction. And we saw reaction at the level of tissue as well as at the level of immunity. So friends, we did try to appreciate through a number of cases that how we are in a position to perceive the characteristicness which determines the reactivity and the tissue changes with its space which determines the reactivity. Now, with the help of a small case of tonsillitis, we could learn a lot of things, that how reactivity can throw off pure, candid picture, and those characteristics will allow you to treat acute effectively. And that's how the stramonium came up with the peculiarity of the characteristic totality which we perceived. While COVID's case beautifully demonstrated that a patient with a lot of comorbidities, a lot of tissue changes, if you perceive forms and examine it from the standpoint of changes taking place at the level of time and integrate them in your totality, you'll be able to identify not only accurate simillimum, but you will have much more scientific pathology which will be effective in practice. So that is how the prescription of causticum 200 and then 1M, as well as interpolation of antimiasmatic like tuberculoid in the case of COVID-19, as well as in the case of meningitis. So friends, all these experiences have helped us to perceive multiple dimensions of susceptibility. And the demand on us is to carry out integration. How we integrate all these learnings in our conceptual framework so that we can perceive totality, the multidimensional aspect of totality, and can prescribe effectively with the correct potency and repetition. And we can also judge remedy response effectively by perceiving all these dimensions of susceptibility. So with this, I will hand over to Dr. Ram, who will introduce our today's speaker, Dr. Dilip Dikshit sir. He needs no introduction and is the perfect person, perfect clinician a great international teacher who will help us in perceiving the various dimensions of understanding susceptibility from the standpoint of tissue, from the standpoint of miasm, and then how he translated them in certain beautiful guidelines, which helped us immensely, whether it is leprosy, whether it is HIV, whether it is COVID. So these innovative guidelines have been extremely helpful. Thank you. Over to Dr. Ram.
Thank you very much.
Hi friends, Dr. Ram here. It's an honor and privilege to introduce my teacher, Dr. Dikshit. He needs no introduction. He is one of the senior most homeopaths since the last 50 years in this line. And in the 70s, he was very famous for his research on tuberculoid leprosy. More than 3,000 cases in Maharashtra. Then came the time of HIV. There also he was very successful in his own unique method and has treated more than 100 to 150 cases. Even now he is continuing the score. And later on came Corona. So he had a protocol for preventive, then he had one for treatment and many protocols for preventing the complications also. In between was malaria, dengue, chikungunya. So all different what you call disease phases. He had his own unique style and which he used and implemented and taught to students all around the globe. And it was super duper success, and we are lucky to learn from him about susceptibility. So help me welcome Dr. Dikshit on the online screen.
Sir, you may start.
Yeah, just I'm getting the screen.
No problem.
I will have to switch off the Zoom and then restart again because the other PPT is not loading.
Yeah, no problem. You do accordingly. Meanwhile, I'll just share with you all very interesting experiences which I used to have with Dr. Dikshit sir. It was 1981, July. I had joined my teacher, my mentor, late Dr. M.L. Thavle sir. And it was mid of 82. I used to attend Dr. Dikshit's clinic. Like in the morning, I used to have a session with sir at Chembur. Afternoon, I will go at Dr. Dikshit sir's place because that was the time wherein he was organizing a lot of material related to leprosy. A huge material. The number of cases for me, I could not fathom them. And there was a task as a young research fellow. I used to go in the afternoon at his place, used to have lovely, wonderful interaction, see those cases, try to listen to the story which he tells and learn from him, those various things, and come back in the evening again to Girgaon. So a wonderful journey from Chembur to Thane to Girgaon, but fully packed of huge ocean of learning. The type of cases which one cannot, imagine. It was around 3 to 4 months. Although there will be relatively few things on the case paper, but I learned a great thing of eliciting a lot of evidence from him by picking up those 1 or 2 things. He was truly like a bogger, writing down those important key features in his case paper. But each key feature would speak of volume. The great analytical faculty as well as the gestaltic perceiving. Thank you.
Okay. So
Yes,
thank
sir.
you, Prabhu. The susceptibility, as I said, is one of the basic tenets of homeopathy, like law of similars, miasms, and all that. But I would say that susceptibility, the concept of susceptibility is applicable, universal in every step of our practice, from receiving the case to the learning from the case. treating the case. Dr. Praful had mentioned about the Stuart Close and his definition of susceptibility. I would go a little further, that actually Dr. M.L. Dowley had used all these basic tenets, put them in one rational clinical explanation, so that their interdependency becomes clear and it is easier for us to operate in practice. So there is no confusion. There is one addition that was done while learning the susceptibility, was that susceptibility is the reactivity at the tissue level. So for mind and nerves have a different way of reacting. So he tried to separate them into susceptibility and sensitivity. Sensitivity is of the nerves, and so whenever we are going to talk about susceptibility, we are going to talk about susceptibility and sensitivity in general. Susceptibility is the reactivity at the level of tissues. Now, the symptomatology, like whatever classification we do, the common characteristics, diagnostics, non-diagnostics, all these physical, mental, PQRS and all these are basically expressions of the susceptibility, qualitative expressions of susceptibility. So they are all expressions of susceptibility. Now, these qualitative expressions, when we compare, as Dr. Praful had said, that Hahnemann had talked about the miasms, sora, syphilis, psychosis. Dr. Dowley had explained the clinical understanding, which I am going to follow in subsequent of my work. That is, this combinations and the patterns of responses. The qualitative appreciation of patterns of responses are miasms. So miasms are nothing but qualitative appreciation of the responses. Now, with the leprosy, when you try to learn, the Hansen had already explained that even though the disease-causing organisms might be same, but clinical manifestations of the disease, according to the susceptibility of the individual, change. For example, lepromatous or malignant, borderline or intermediate, and tuberculoid or benign. So even the Hansen had recognized the importance of susceptible constitutions, that though the causative organism is same, they react differently to it. Right. Okay. Actually, I was working with Dr. Tharkar, Dr. A.D. Tharkar, who was a skin specialist. He used to come to me to learn homeopathy. And the funny thing was that he said that I will come to learn homeopathy with you, and I had no patience. I told him that my first patient came after 6 months. So if you come to my clinic, what you are going to learn? I don't have patience to show you. He said, don't worry about that. I have thousands of patients. I don't want to see their faces, but they keep coming back. And I feel awkward to face them. So he's referred this. Hello. Hello.
Yes, sir, you are audible.
So this case was referred to me with the lepra reaction, what we call after Dapsone. 70-year-old female, she was obese, Sindhi lady, extensive anesthetic patches on both the front portion of the leg shins, and she was on allopathic treatment with Dapsone since few years. At the moment, she was having lepra reaction, severe burning all over the body, forcing her to use cold towels for relief. 24 hours, intense itching, restlessness, mental as well as physical. Hot patient, obese. Case details were taken on the basis of the totality. Calcarea iodide 30, 4 hourly was given. In 4 to 5 days, the lepra reaction subsided. And in 2.5 weeks, the anesthetic patches also showed drastic improvement in return of sensations. Calcarea iodide 30 was continued 4 hourly. Tuberculinum 1M was used weekly as an intercurrent. Now, this was my first case of leprosy, and I was, at that time, I used to be with Dr. M.L. Dowle. It was somewhere in 72, 73. So I told him that I have treated leprosy and this was the case and this is the result. Because I had, when this case came, I had tried to do the reading to find any precedences, any reporting of the leprosy cases and all that. They were not there. And when I told him, he said, good, but ye to matka hai. This is a fluke. The patient has improved and your next patient is not likely to improve. Unless you are able to give me a logical reason why this patient has improved. I tried to find some explanations which he was not happy. Then same next week, I had another case. Actually, I was called for give lecture on homeopathy at IMA Dombivli. And there I talked about homeopathy and all that. And next day morning, all the 2 or 3 consultants, they came to my clinic because I had told them about homeopathy and they wanted to learn. I had told them I'll give them books and all that. At that time, this boy was sitting there. This boy, 12-year-old, very fair, and on the thigh he had this big patch. And his parents had bought because there was a lecture on leprosy in their school, and he was demonstrating, see, I don't feel the pain, and he was pricking this with the needle. And those 2 consultants who were there, they saw this boy waiting in the waiting room, so they asked him for what he has come. And then they examined the child, saying that it is leprosy. And he was sent to the for biopsy on the same day. From there, he was referred for the biopsy. He was, because these 2 people had come, I was in a hurry. He was to go for the biopsy otherwise also. So I wanted to give some acute. There was some slight throat irritation. So I gave him Merck IF 4 hourly and sent him for biopsy. Next day, week, he came with the report and all that. Those two consultants were again there to return the books which they had taken earlier. And they saw this boy, and the anesthesia had disappeared, the discoloration had disappeared, except the stitches were still there for the biopsy. And they saw the report and they were shocked that in 1 week, the tuberculoid leprosy patch had disappeared. Again, I showed to Dr. Dowley. Again, it was the same. This is a fluke. Next case is not likely to improve. So I was trying to figure out various totalities, various explanations, but he was not even making any comments. He would just look at it and there was no comments. So I tried to, till by that time 10 to 15 cases came. All of them were improving, but still there was no explanation why they were improving. So this was the problem definition that was made at that time, that in all cases there was scanty data, absence of characteristic symptoms, disappearance of earlier characteristic symptoms of chronic or periodic disease, common tubercular base, presenting miasm totality is descriptive type, syphilitic, most of the patients, tubercular in neural cases. Because one category that was not mentioned in this is tubercular neural cases, where only the nerve involvement, thickening used to be there, and tingling and pain and contractions and deformities and all. Initially, we had tried the normal approach of intercurrent, constitutional and all that. But with the constitutional, we could never get that dramatic response in short period. Again, the lepra reactions were also a big issue. Subsequently, more complicated cases started coming. Actually, in those days, we used to write for a local weekly, and there I had written 1 or 2 articles on leprosy, our experience with the leprosy and all that. And the response was so phenomenal that in 1 week we got 800 patients from all over Maharashtra. And that was the impact of one article published in a weekly. And the patients were improving. So this was the final understanding which Dr. Dowley accepted. And we had, because with this, there was no other argument, that in all these cases, when we did all those 15 cases, and to get visual understanding, this was the fundamental miasm in all these cases was tubercular. Attributes or constitutional symptoms were either absent, or even if they were there, the prescription based on them, they were not responding. And what is available, because almost 99% of the cases, there is one common element, that they had never been sick in their life, they had never gone to the doctor except this particular lesion, and that is the first time that they are experiencing illness. So that is what is the presenting data, is the syphilitic. Now, so once this explanation was there, it was very easy that we had to give tuberculinum as intercurrent and give anti-syphilitic remedy. Whatever may be, there is no, because normally there are no complaints, so there are no indications. So there is no basis for selecting a remedy. So we decided that you give any anti-syphilitic remedy. Only precaution that we took, that we saw that if the constitutional glimpses are available, then don't give any inimical remedy to his constitution. Suppose if he is silica, then don't give mercury. Otherwise, any antisyphilitic, and the patients used to respond. There are about 23 or 25 remedies which were in few cases. There were very characteristic symptoms available, PQRS, like left foot was kept uncovered. Otherwise, the patient was chilly, except the left foot. And on that, hura was given. And with the hura, the patch disappeared. Hura brasiliensis. So this understanding the problem resolution that was done was treating dominant miasm with anti-miasmatic remedy, alertness in spotting changes in symptoms and phases, frequent use of tuberculinum and bacillinum intercurrent remedies, prolonged medication with indicated remedy in low potency, utilizing Hering's law for right progress. Now this anti-syphilitic remedy was given. Now that boy which I said that in 1 week the entire discoloration was gone, the sensations were resumed. He was treated for about 3 or 4 months after the disappearance of all those symptoms. And after 2 or 3 years, again he developed another patch. Again, the same Merck was given, but this time we decided to continue the remedy. Why the relapse came? Because the Hering's law was not followed. We had not understood the susceptibility. We had not restored the susceptibility. We were focusing on the anesthetic patch. So just getting rid of symptoms is not cure. Restoring the susceptibility or body's reactivity is the actual cure. So in that case, we continued Merck for 2 or 3 years. There was no aggravation, 4 hourly, and then after 2 or 3 years, the aggravation came. And that was the receipt that now he is cured. Now he will not get. So this was seen in almost every case. Even though the symptoms or the patch used to improve faster, but cure would take number of years, 1 year, 2 year also. And once it is explained to the patient that this is what is to be expected, they used to follow. Means there were less dropouts once the initial improvement had occurred. So this is the learning about the susceptibility, that how we decide cure. Now in this entire study of susceptibility, which I had explained now, were only tuberculoid leprosy. The intermediate or borderline tuberculoid and lepromatous leprosy, they are totally different. To treat them, you have to have a totally different approach. the same approach or technique will not work. It needs understanding of the susceptibility or constitutionals and other thing. We won't go into that because we had comparatively very small number of those cases to make an authentic claim about treating those borderline tuberculoid and lepromatous. But almost tuberculoid, leprosy were the main thing. Lepra reactions needed, again, it was mainly tuberculinum alone would deal with the lepra reaction or the constitutional. There, the antisyphilitic role was not there. But if the constitutional, like the first case where it was calcareous iodide as constitutional, it worked within a short span, I think 2 weeks, the whole thing subsided. Now, after this, I was going to Australia in those days, 83, 84. I got first case of HIV. He was a homosexual. He was being asked to report to the medical association every fortnight and all that. And he had the lymphatic presentation, all the lymph glands all over his body were enlarged. Lachesis was given and tuberculinum. And after 4 or 5 months, the medical clinic asked him to stop reporting, that he's just wasting their time. He is not a HIV case. Now, this was the first case where they had the clinic had rejected him, that he was observed for so many years, and now they have asked him to that he is not the case. But in those days, the reports or the Western blot and other tests were not available to homeopaths, or even otherwise also, I doubt. Subsequently, I have treated more than 150 or 200 cases. Our experience with HIV disease, the susceptibility in them, is still not complete because there are conflicting experiences. Where you get all the data about the constitution, symptoms, characteristics, everything is available. But, and when they come with ordinary cough, cold, fevers, and simple things, the normal remedies like Hipersol, Pulsicula, whatever normally we give to individuals, they respond very quickly, they recover very fast. But the CD4, CD8 count does not improve that fast with the constitutional alone or intercurrent and constitutional. So what is the understanding in terms of susceptibility? Why are they responding so easily like every other normal person to a remedy? That means the susceptibility is natural in them. And why their CD4, CD8 and other parameters go down gradually. Viral load is also another marker. So we tried the Banerjee technique, where first molecular understanding of was used. And that gives success, especially if the constitutional is available. If is Calcarea, then use Calcarea as in the 6x, or if is Natrum Phos, then Natrum Phos 6x plus Viola, Pura, and one or two other remedies are there that you take Calcarea Phos 6x and Hura 6, medicate them and give it 4 hourly, and in a month's time, viral load which would be more than 70,000, 80,000 would come to less than 20. Patients are asymptomatic otherwise also for first 5-10 years. So still we are struggling to understand this difference between the acute illnesses which are normally there, but it is not the same, because if it is viral infection, I had few cases with COVID, HIV patients who got COVID, and surprisingly, they recovered just like any other person, normal, without any complications, and in the same period. But we did CD4, CD8 in their case, where in one case, CD4 was 160, which was quite seriously low. And after 1 month, it was 380, which was almost to the safer zone. Now, then we saw that why not try in normal course without having the corona or anything. Now, it was our COVID protocol that was given. Calcarea Phos, Zincum Met, and China R6. And that brought this drastic change in the CD4 count, CD8 count. So we have done about 8 cases, the CD4 count with 1 month's preventive protocol medicine was given. And all of them have shown the CD4 count improves. So that is what is with the HIV. After that, at Ram hospitals. Now at the Ram hospitals, when we decided to start homeopathy, I was anxious to take because I was told that I would give the advice on phone. I may not be present there every day and all that. At the same time, I knew that even though we get children, pediatric patients in our clinic, that is different. We get the results. But in a pediatric hospitals, the kind of patients that are going to come and at the volume at which they would come will be extremely difficult. It is not charted territory. And if there are so many acute cases where pneumonia, typhoid, malaria, dengue, and all that will come, we must have an answer, theoretically answer ready to deal with those eventualities. If 10 cases of pneumonia come, and if we are going to follow the Borderlands pneumonia or this pneumonia and that pneumonia, I think we will be in real stressful situation, because every case to watch so many parameters and judge would be very difficult. So it was decided that we would first have a strategy of how to deal with these cases. Luckily, now whenever I'll give you my thinking process of how we approached, because every illness is a battle that is going on between the host and the adverse circumstance or invading organisms or virus, bacteria, whatever it is. During this battle, there would be times when the host is having the upper hand, when the invading organisms would have upper hand. So if we are able to judge that battle when the host is having a upper hand and we introduce the deeper acting force, you will require minimum dose, minimum repetition, and faster results. So that was the logic on which we judge the susceptibility. So it requires, to understand this, we need to have a better understanding of susceptibility. And there, Dr. Ram explained to us the virgin susceptibility, what it means, how. And once we got the feel of it, it was very simple. And I think first case was typhoid. As I told you that earlier, my experience with typhoid, in fact, had been quite traumatic, means very difficult. In fact, in my practice, when I joined one charitable clinic in Mulund, and first case was of typhoid. And he was staunch follower of homeopathy. He would not, even if I had told him you go to allopathic doctor, he would not go. So it was my moral responsibility to go and visit him every day. I wanted to see that I am doing everything. At the same time, I was taking advice from Dr. Dowley, day-to-day management. It took 2-3 weeks of anxious period, and most of those typhoid cases used to have those pattern of evening rise of fever, 4 to 8 p.m. and chills, fever, toxicity, diarrhea, so many issues. And you never got that convincing feeling that your medicine has cured him. Somehow he got all right. That was the feeling I used to get. Even in MLD's case, I used to go to visit the patients. And I used to wonder why the patient is not giving up. Because MLD was not going to tell them to go to start the allopathic treatment. And we were daily analyzing the chart, keeping the fever chart, chill, fever, how much degrees, and all those characteristics were there. So when this solution was ready, and luckily we got 3 or 4 cases in one day, and Dr. Ram made that comment that most probably this is enteric, the child is looking toxic. It was on the first or second day only. So I thought this is the best time to try our understanding, and we gave TUB. Next day there was no fever, the child was almost normal. Second day we gave constitutional, and in fact Ram sir was going to discharge the patient the second day only. We asked for the constitutional to be given, and then we were able to. Then we followed the same pattern with every systemic illness which covers like typhoid, pneumonia, malaria, dengue. Everywhere we were able to get the similar pattern of response. And that made the life very easy, because afterwards we stopped. I think the physicians stopped asking a malaria patient what time the chill is coming, what time the heat is coming, or whether there is sweat or not, and all that, which earlier used to be very meticulous, whether there is one single paroxysm or double paroxysms, what is the totality with one paroxysm, the other paroxysm. So earlier we used to define in MLD's time also, morning chill, we are giving China, evening lycopodium, and it used to be really painful process of treating them. So here we saw give one number to TUB or whatever intercurrent is, and next day the constitutional. But there was a catch to this also, because now this was the process in which we were learning about behavior of the susceptibility. If we had given acute remedy, if the patient came with, say, cough, cold, and then went into pneumonia, if we had given acute pulsatilla or hipersulf or anything, then this technique won't work. We won't get the same results of giving TUV and constitutional. That means our remedies also alter the susceptibility in a different way. So that understanding has to be there, which force we are going to employ and ability. So we did find a solution afterward, but then there were instances when for 2 to 3 days we have kept the child and not a medicine was given till we found the right time, and one single dose and everything used to resolve. So this was the understanding of it had changed, though this learning should have come after the understanding of leprosy. It is the same understanding that was of that chart that was drawn. If we are able to visualize a case and put that in that frame, I think we are able to find which force is to be given. Then we have the materia medica and your repertorial syndrome and all that. So with this, there was another understanding which only Ram Hospital could give us, was with the cases with atopic dermatitis and hypersensitive, highly susceptible patients, where we did not dare to give the constitutional or deeper acting remedy because of the sensitivity and susceptibility. And we tried giving a 50 millisiemal or third dilution, fourth dilution, 10th dilution. I think this dilution business also started in Ram Hospital first, because the susceptibility was such that the 30-200 was likely to create more trouble. That was our fear, and that is why we tried the first dilution, second dilution, third dilution. Even when that also did not work, then we tried 50 millisiemal. But again, that was also learning that 50 millisiemals don't cause aggravations is a misconception. They also cause the similar type of aggravation, but of a different level. But aggravations do come. And then we had to, in some cases, give 50 millisiemal in third or fifth dilution. So this was the learning at the Ram Hospital. Then I think we will so now we will go to the COVID experience. It was the same, that we are having at my place every Tuesday, the practitioners are meeting for a clinical session, and we discussed for last several years. We are meeting. After the COVID, it has gone online. So people from all over the world are joining, and there we are able to share the experiences. So in this Tuesday meeting, everyone was asking, what about Corona? We did not have any case till then. We only were getting reports in Iran, so many people are dying, and Germany, so many people are dying and all that. And it was pandemic was declared. The Ayush declared that arsenic was going to be the remedy, though nobody had treated, nobody had seen. And obviously, we felt that whatever stories we are hearing doesn't seem like arsenic totality. So I thought that why not try different understanding? We are not supposed to, so at least theoretical answer we should have before the cases came. So I tried to understand the qualities of this coronavirus. What are its strengths, how it operates, how it gets strengths, or how it attacks the host cell RNAs, from where it gets nutrition. And there we were able to understand the molecular biology of the virus. And we anticipated the combination protocol which would work by facilitating the zinc inside the spike protein and neutralize it. And that way reduce the viral load and should act, which has worked. But this was only hypothetical when we first decided. Now, when we saw that how the virus is protecting itself, how it forms a shell, how it changes the polarity and all that, and we decided to make use of the law of potentization, the trituration, where it is the medicine that has a positive or negative charge. So that polarity reversal can be countered with the X potency, which would repel. And that has, so we won't go into that details, but I think everyone must be aware of it because it has been explained. So we would go to in that thinking, these two references were extremely important. One was the research at IIT Mumbai by those Jayesh Bellare and his team about nanoparticle studies, that they were able to demonstrate the nanoparticles of the original material in the homeopathic potencies. So we were counting about the nanoparticles being present in 6 potency of zincum met as well as China Rs as a iron of 4 and enter the cell. And the polarity part will be taken care by the X potencies. Experiences. Now these are the first case we got. By that time we were getting the feedback. We didn't have cases here, but we had patients from US and other places, and they were the first case is of the 27-year-old female from Texas, COVID positive, had complained of fever, breathlessness, headache, throat pain, and all that. And we could easily see this. We had asked the protocol, those Calcarea Phos and China and zincum to start as preventive. But it was obvious that the genus epidemicus seems to be Bryonia. It was seen In Italy, it was seen in Israel, in Germany, in America. If you see, the Bryonia is the genus epidemicus, but how long you are going to give as preventive? Because normal person is going to get aggravations. You can't, the pandemic is going on and on for months together. So you need something unique which can be continued for a long time and would be able to give the proper prophylactic shield. So these are the cases and their recoveries. That the bryonia had been the main, almost 90% of the cases required bryonia. Other remedies that came were gelsemium, rustox, pepper, and last arsenic. These are all these cases with various patients. Again, the now this Tuesday group has given this remedy combination to thousands of people, and we had very few cases which got infected, but very rarely anyone went to the ICU. Few people did require oxygen. So that was great success that most of the people got. If at all they got it, it was very mild or asymptomatic, this thing. But accidentally, one of the patient, Tuesday group member, had given the prophylactic to one family. And the lockdown occurred and they could not go out. And the family member developed COVID symptoms. Now there was no way that they could collect the homeopathic medicines, and so, but they didn't want to go to the hospital. So she said that take that preventive every 2 hours and report. And surprisingly, within 24 or 48 hours, that patient recovered. So this was the learning, that our combination is not only preventive, it is curative as well, and mellows down the entire illness. And then we have started, and it has proved to be effective. Now, this theoretical understanding of molecular this and that has again a twist, because as I was experimenting, we were getting positive results in patients. Patients were improving. I tried to do this. I got the opportunity to get the experiment done on culture sensitivity to this particular combination. So in Germany, I got a lab which agreed to test, and the problem was that the potencies that are available here or 6C, and this is not available in Germany. They don't have 6X. Then the question came that in the culture, if the alcohol potencies that are available here, the alcohol might destroy the virus. So I contacted one of the pharmacies in UK, who the head pharmacist agreed to prepare the water potencies with minimum alcohol content so that to keep the stability of the solution. And he gave those medicines. He posted them to Germany, and the experiment was conducted. But to our disappointment, there was no change in the growth. Within 24 hours, the dish used to be flooded. Those samples were from unique variety, and the material was the linings of the cancer lung epithelium, and that is why possibly those responses were there. But same thing was working in the patients. So, and this was not a single experiment that failed. They did at various stages, because there are so many people were doing their experiments there. So they tried to see the doubling and all that, but it didn't work in that. But in live, yes. So I think this is how the understanding of susceptibility, which started with leprosy, and then their visualization helps us. So I think if I go on talking, I'll go on and on, but this is how the success with COVID is there. In fact, I recently got yesterday a report from Italy that those NGOs have started using our protocol and giving hundreds of people, and they are saying there is wonderful result. The patients improve straight away within 24 hours. So this unfortunately cannot be termed in that sense homeopathic prescription, but it is a homeopathic prescription because we are using the homeopathic laws of potentization, the benefits of potentization, the nanoparticles that are there in our homeopathic potency. It cannot be given in crude or without potencies. If you give this material, it will not work. So we have to append our understanding of homeopathic. I think so. Any questions or?
Yes, you can put down your questions in question answer box, or we will unmute you if you wish to talk. Dikshit sir, can you just go out of your slideshow if you can stop screen sharing? That
Yeah, I have stopped. Stopped.
yeah, that's
Okay, so
there is a question for you. How the prophylactic protocol of the drug was used, repetition, etc.
prophylactic was used basically. It is the tuberculinum is to be given on day first, and then the combination twice or thrice a day for 10 days in a month. Or if you come in contact with an active case, take for 5-10 days. So people define themselves that if they want to go for a movie or some gathering, they would start taking it a couple of days earlier, enjoy and come back.
So this protocol contained calcarea phos 6x along with zincum.
Calcarea phos 6x is medicated with zincum met 6c and China R6c. The idea was that if you know the COVID virus, it ejects the zinc from the cytoplasm. The spike protein, the zinc is inimical, so it throws away the zinc and closes the gate, so no zinc can re-enter. And China, all cinchona derivatives are ionophores, means they open the gate, and our potentized zincum is able to get in.
Incidentally, the first preparation was made by me and Dr. Dikshit. March 20th, when the lockdown was announced, sir had closed the clinic. So he said, you get first calcarea first and then put zincum. So that is how we made it, and then it has spread to so many. Thank you very much, sir. It's a very, very useful prophylaxis.
We have Dr. Deepa, who has been working with Dikshit sir. So I'll just request her to, she would like to share her experience.
Yes, she had treated more than thousands of cases of COVID successfully, many of them who required oxygen. Even in her own mother's case, she had the guts to deal everything with confidence.
Yes, Deepa, you can go ahead and talk.
Yeah, good evening to everyone. Good evening to everyone.
Yeah, nice to see you.
Yeah, it's really, I was really happy when this Friday sessions were announced, and I felt that it should happen every Friday on and on, so that I can meet my all teachers, Dr. Barvalia, Dr. Ram, and Dr. Dikshit. I'm working with Dr. Dikshit since almost last 20 years. And it's a fantastic experience, and I've learned about managing susceptibility, which is the topic for today. That how to get the gauge of the susceptibility, qualitative understanding of it, and morbid susceptibility, and then to make it healthy, which we can do it with our potencies. So I have promised sir on his birthday that by next birthday, I'll be able to write one book about my experiences with Dr. Dikshit. And regarding management of COVID, yes, this protocol do work. It works really fantastically. I will say not only in COVID, but also in viral fever. When I've used, because in last 1 year, whoever comes with fever, it is COVID suspected case. So when totality is not clear and we have to wait till it emerges, I've used ZC in many of the cases with positive result. This is regarding suspected cases, but confirmed positive cases with high CRP, high D dimer, and where IL-6 is high, this works fantastically. What understanding sir is giving has a lot of baseline study about the susceptibility as well as about the understanding of disease. And this I have learned from my experiences at Dr. Ram Sir's hospital, where clinical understanding is very, very important whenever you are dealing with any case, apart from homeopathic understanding. So, yeah. Recently, I have treated a case where I got one WhatsApp right now while attending this Zoom. A child having, father having is RT-PCR positive, and he got himself admitted before starting my treatment. And the child, son, daughter, and wife, out of which wife and daughter are negative. They are on protocol, this protocol, as well as TUB was introduced on the first day. And child is on Bryonia and ZC, and his all reports are normal, although RT-PCR is positive. So I thought that I should share this experience, and I would like to thank Dr. Dikshit, Dr. Ram, and Dr. Barvalia for this great learning. Thank you very much.
They have been asked, somebody is asking about joining the Tuesday group.
Yes, sir.
Yeah, this this session is from 8:30 to 10:30. We have students from Australia and US and India, and it's completely learning packed session, which is no other means, and it's very free kind of sharing where every participant is expected to work and present something, as well as I think so you should ask people to join and spread the learning.
Nice.
Yeah, thank you.
It's been asked how to join the group, sir. If you can.
Yeah. All of you should contact Dr. Deepa. She will release the protocol and things.
Thank you.
So there was one more question for you. Like when you explained that there are times in the disease where the host has a grip over the invader, and at times it is an invading organism that has a grip over the host. So in terms of COVID, how do we understand the cytokine storm in that light?
That is what, as I was going to talk, but I thought that the time may not permit all the details. But if we see while treating the COVID, you have to understand the COVID illness. His first 4 or 5 days is a viral phase. At that time, the actions are different. And after 5th or 6th day, when the cytokine storm will start, there are certain restrictions what medicines you can give after 5 days and before 5 days. And actually, I had asked Dr. Deepa to be called only to give that demonstration that when we give TUB in first 1 or 2 days, TUB followed by constitutional, things settle. But after 4th or 5th day, when the cytokine storm is on and we give TUB, it can create real mess. Patients may go down faster, or it is the indicated remedy like Bryonia or whatever it is. But this preventive one works. So that is anytime you can give. So it is dependent, cytokine storm management will depend upon which day you are entering. When it is going in full gust with full steam, then you have to be also matching your remedy and potency and repetition. In fact, in some cases, we have given Bryonia 1 hourly for several days. Even after aggravation, we may stop for some time and then the same totality is there. So again, you resume the Bryonia same way. So best is not to allow that cytokine storm to set in. We can abort the whole process much earlier if we are able to intervene.
Thank you, sir.
Report on Interdisciplinary Workshop. M.B. Barvalia Foundation's Spandan Institute, established by Dr. Praful Barvalia, is dedicated to the children with developmental disability and mental health issues. It provides its services through holistic, multidisciplinary approach. We had wonderful interdisciplinary workshop under guidance of renowned neurologist Dr. Praveena Shah. This was held on 29th and 30th June 2019. This was workshop for children with autism, cerebral palsy, and epilepsy. Objective was to provide A. Multidisciplinary evaluation by all experts. B. Intensive occupational therapy, physiotherapy, neurodevelopment therapy, and speech therapy, etc. C. Psychological evaluation and counseling under a psychologist. D. Valuable inputs, form special education. E. Focus on life skill management. F. Benefits of homeopathy and yoga. F. To provide home program. Following experts gave services. Dr. Praveena Shah, Senior Neurologist. Dr. Praful Barvalia, Convener, Senior Homeopath. Dr. Dhruv Mehta, Senior Physiotherapist and Co-Ordinator. Mrs. Sujata Srivastav, Special Educator. Dr. Prachi Barvalia, Neurologist. Dr. Ram Subramaniam, Pediatrician. Dr. Alka Barvalia, Homeopath and Yoga Therapist. Dr. Darshana Bajge, Physiotherapist. Dr. Neha Kamble, Occupational Therapist. Dr. Rahul Suryavanshi, Homeopath. Mr. Kotwal, Orthotist, Prosthetist. Dr. Bishnu Behra, Psychiatrist, Homeopath. Swapnil Kadam, Social Worker. Discussion among clinicians of the panel gave very good insight about nature of complex neurological disorders like refractory epilepsy, Pelizaeus-Merzbacher syndrome, Duchenne muscular dystrophy, and their multidisciplinary management. We have evaluated 98 children in the camp, and many of them attended workshop and subsequent free therapy and management program. Orthotist and prosthetist, Mr. Kotwal, very senior allied health professional, assessed functional limitation of the child and discussed the design of mobility aid and counseled the parents about its utility. We provided free mobility aids to number of disabled persons from low-income group. As Swami Vivekanand says, every soul is potentially divine.
We have Dr. Kishore Mehta sir with us. We have Dr. Kishore Mehta sir with us. Can we request him to? Yeah, Dr. Kishore Mehta sir, can you please give your remarks?
Good evening, everybody. And as usual, Dr. Dikshit, when we were together in ICR, Dr. Dhole, Senior Dr. M.L. Dhole, while session was going on, and he wrote one word, wizard, W-I-Z-A-R-D, wizard. And this wizard award was given to, not award, but this was given to Dr. Dikshit. And Dr. Dhole could see in him the gems of his wisdom, which was underlying. And Dr. Dhole could make it kinetic by giving all the clinical aid and help to Dr. Dikshit, if I am not making any mistake. And Dr. Dikshit also, with his own wisdom and with his own understanding, he also evolved himself as well as he evolved the homeopathic system of medicine in various illnesses which otherwise are very difficult to treat and cure. If you see in today's lecture of him, he started, of course, with a definition of susceptibility and qualitative aspects and individualization aspect of susceptibility to just introduce to us what susceptibility means. But then as he went on, his journey started with a simple case of lepra, not a simple case, of first case of lepra, and subsequently number of cases of lepra that he studied. And from all these experiences, what he could bring out was what would help lepra or any illness later on, serious illness, that unless we don't give constitutional or even anti-miasmatic drug, and that too for a very, very long period, till then probable cure or recovery is not possible. And that is what hard work he must have put to observe so many patients for so many years. And mind well, he says after 2 or 3 years, the reaction, the aggravation occurred and the patient was okay. And that is very much in similarity with aphorism 161 of Organon, wherein chronic disease, the cure appears, the aggravation appears when the cure has to occur. And that is what Dr. Dikshit represented or gave us demonstration through his lepra cases. Now, once the experience of lepra cases brought him to certain concept of prescription and inevitable prescriptions and the observation required after prescription and what a patients are required to see the result, that again brought him to another area of his practice, and that was in relation to AIDS and then later on COVID. Typhoid, when we were in ICR, there was a lot of conflict amongst the two groups. When Dr. Dikshit, Dr. Dikshit, please correct me if I'm wrong. Dr. Dikshit was telling that even in typhoid, you start with constitutional remedy and it will cure. So some of them they agreed, some of them they did not agree, some of them had some other experiences. But Dr. Dikshit's concept of giving constitutional drug in typhoid was carried on for a very long period. And what he was talking about experiences at Dr. Ram's hospital, particularly about children and pediatrics, cases like pneumonia and other things, where he, see, all of us are directly or indirectly following Organon in a different way, but we are not able to speak out or spell out, where he was talking of managing the acute conditions with whatever indicated drug and then followed by constitutional drug, which is given in Organon. But most important thing comes in his talk is the last part of COVID management. Here, not only the host susceptibility is understood, but is going the other way around also, where he gives us idea that we have to also study the nature of the disease. And that is virus. The virus, how virus acts and what changes occur in virus and what changes in turn it occurs in human body. And that is how he could perceive the importance of Banerjee's protocol in cancer. And he had also treated many cases of cancer. He tried to understand and applied similar protocol in COVID, where Dr. Dikshit has a wonderful success in that. In fact, I had a long talk with him and he had also sent me certain write-up when we were talking on phone about the zincum and calcarea phos and this protocol. And at that time, it was the beginning of his experience. And he was saying that as soon as when it is completed, we will put forth before the fraternity. And today, the way in which he has explained us, I think the topic of susceptibility has been covered up. Both sides of the parties involved, that is host as well as environment, And as he rightly said, sometimes the host is on the top, sometimes the virus is in the top. And that is how the play of game is going on. And where we entered, which one is dominant has to be addressed. And that is a really wonderful thing that we have learned, particularly of COVID. And very rightly he said, certain for first 5 days, you give constitutional drug and patient, the case can be aborted. And that is what Dr. Dhaude taught us in our training program, that he was talking of aborting the case of asthma to occur, or chronic asthma occurring in the recurring again and again. At certain stage when the asthma just initiates, at that time give constitutional drug. He was talking of antimony tart and kali sulf and many other drugs he had talked of. Similarly, Dr. Dikshit also told us today how to prescribe the constitutional drug so that it can be aborted. And wonderful, Dr. Dikshit, I really appreciate your hard work, and your whole journey speaks of your sensitivity, your susceptibility, and not only your susceptibility, but your hyper normal susceptibility to train the doctors and treat the patient. Thank you, Dr. Dikshit, very much. Dr. Praful Barvalia, thank you very much for including me in your group. And well, if I get opportunity, I would also like to join Tuesday group. I will be having a talk with Dr. Dikshit and Dr. Praful Barvalia, and let's see if we can make the whole good team of us. Thank you very much.
Thank you, sir. We learn from you, definitely. You are our great teacher. Thank you, sir. Thank you for beautifully summarizing the journey as well as teachings of Dikshit sir. We have Mrs. Rohini Belsare, madam, with us. May I request you to just speak few words, Mrs. Belsare, madam?
Yes. Can you hear me?
Yes, we can see you. We can hear you. Thank you.
Dr. Dikshit has very beautifully given the spread of his experience in the issue of susceptibility and the host and the environment, and what happens to the susceptibility when right medicine is given. It was lovely to hear him. Thank you.
Thank you. Thank you, madam. Thank you.
Nice to see you, Belsare, after long many years.
Yes.
Thank you.
And we must thank Dr. Praful for that, made us to see each other.
Of course.
No, thank you. My pleasure and privilege. In fact, we all are together. So we have been having this wonderful journey. Friends, we could see that the experiences which one passes through and what meaning one gives to experience. Hanuman told us that the homeopathy is the medicine of experience. And Dikshit sir's presentation beautifully puts across that how do you relate to your experience? How do you relate to your failure, your successes, and how you deal with them? Of course, he has fantastic innovative spirit within him as well as resources. Along with that, the way in which he deals with his experiences and brings about the superb conceptualization. So all these are very important aspects. It is always told that whether it is clinical medicine or any aspect of life, quite often you are required to take jump. But friends, we always must remember that we should jump in a way so that our feet always remains grounded well. So this is what we learn from Dikshit sir. He has been taking a lot of jump, but we can at the same time see how beautifully he is grounded to the Hahnemanian conceptual matrix. So then only he'll be able to grasp essence of his teaching from leprosy, from typhoid malaria to COVID. Now, we have been talking about this susceptibility time and again. And I think we come back again to Stuart Close. We shall see that the kind and degree of reaction to medicines depend upon the degree of susceptibility of the patient, and the kind and degree of susceptibility in any particular case or patient depends largely upon how the case is handled by the physician, for it is in his power to modify susceptibility. Indeed, this power to modify susceptibility is the basis of the art of the physician. See, perceiving, taking action, and modification. What Stuart Close has written centuries back, we can see beautifully in Dikshit sir's actions, that how it is being translated in practice. We have in fact overstepped our time limit, but I am still tempted to share one experience with Dikshit sir. With that, I will summarize and conclude everything, which was in 1982 when I saw one patient at his place with lepra reaction, foot drop, very bad patient. Now, extremely chilly patient, hypersensitivity, correlating with the syphilitic miasm. Heparsulf was given. Heparsulf beautifully brought about a lot of positive changes, and sometime with improvement, even the foot drop like things started showing significant improvement. Everyone was amazed to see the quality of improvement, and simultaneously you see change in the thermal sensitivity and the fever pattern, which was now more in the evening. The chilliness of hepar, that hyperthermal sensitivity, reduced to a great extent, a definite change, and that was the time lycopodium he had given, which further enhanced the journey towards resolution. Much later, I studied that case, and then the silica had brought about the total resolution of that case. So see the phase, see the way in which you identify them, you relate with them. There are innumerable cases. All of us try to perceive those cases and see that how we make mistake, but then we learn. Like last time when I shared with you the China was a mistake. We should be able to perceive that and see in the typhoid case, and the moment we gave Natramur, how the entire case resolved. So we learn from such experiences. I hope with this, now what Stuart says again, I'll conclude our webinar with this. If the physician knows how to modify susceptibility in such a way as to satisfy the requirements of the sick organism and bring about a true cure, then is he a physician indeed? Since cure consists simply in satisfying the morbid susceptibility of the organism. Mind the blue highlighted sentence. Since cure consists simply in satisfying the morbid susceptibility of the organism and putting an end to the influx of disease-producing causes. Thank you, friends. With this, we conclude. Thank you. Next Friday, we have a wonderful session of Dr. Munjal. We look forward to that. Thank you. All of you must register to that in our Learning Sparks channel. If you subscribe, you will automatically receive all the input. Thank you. With this, we conclude. Okay, Dikshit sir, we conclude.
Dikshit साहब कैसे हैं?
बस मजे में हूँ.
Very nice lecture you had, and a lot of learning occurred, And the evolution shows how susceptibility has to be perceived and addressed, and accordingly make utility in our practice through right medicine and right potency. It was really very good, It refreshed all my past day studies in ICR, for so many days. Thank you, Dr. Dikshit, very much, Dr. Ram, we have not seen each other, but for a long time I have been hearing about you.
Yeah.
And we are thankful to you to give us some support for homeopathy. We are very thankful. And Praful Barvalia, as usual, always ahead and leader in bringing up homeopaths and homeopathic system. Wonderful work that he is doing in his hospital.
Your
I have gone
blessings.
2 or 3 times. 2 or 3 times I had gone there, and every time he had shown me something more and more added up in the work that he is doing, And I really love him from all this, because he has been a wonderful worker in homeopathy.
Thank you, sir.
Thank you very much. Thank you.
So, Dikshit sir, your last sentence and we.
No, I think I just presented the experience of my journey.
Sorry?
I have just shared my journey with the COVID that is going on. The encouraging parts as well as discouraging part, especially the culture sensitivity response. Then we thought why it occurred, and we got the reasons that the CA lungs epithelium is going to behave like a CA and not like a normal tissue. So obviously we are expecting a normal response from an abnormal lung tissue. And of course, there is no susceptibility there.
Right. So it is a bilateral perception of host and the virus both, and the nature of both, and the responses of host at a particular time and a response of virus at a particular time in the host. It's a really interplay, very rather a tricky thing. Requires high level of sensitivity.
It is also observed, for example, even a simple things like a snake bite which kills, or a poisonous snake, but it doesn't kill everyone. It depends upon the hosts, whether there was fear or they was fearless, he was anxious, he was not anxious, whether the snake was disturbed, he was happy or unhappy or irritated. All will have the result will depend upon that. So
that is what our sir was talking of, circumspection, looking through all the.
Yes.
Okay.
Okay. Thank you. Thank you all.
Thank you, sir.
With this, we conclude.
Thank you.